If you are paying for health insurance every single month, but have no idea if you are actually using it the right way, this video is going to change that for you. Today, we are talking about how to use your health insurance proactively before something goes wrong, before you get a surprise bill, and before you find yourself confused in the middle of a healthcare crisis. Stay with me because this one is important. Welcome to Health Insurance Insights. I am Donna, and I am so glad that you are here where we are working to bridge the gap between the healthcare you receive and the health insurance you pay for. Let's start with something most people do not even realize they're doing: using their health insurance reactively. Reactive usage means you only engage with your coverage when something goes wrong. You wait until you're sick. You wait until you get a bill. You wait until something gets denied. And by that point, you're already stressed, already confused, and already behind. You look a lot like my avatar on the screen. Here is what reactive usage looks like in real life. And I want you to be honest with yourself as I go through this list. Have you ever gone to the ER for something that could have been handled differently because you did not know your other options? Have you ever been surprised by a prior authorization requirement after you already scheduled a procedure? Have you ever skipped a preventive appointment because you were not sure if it was covered? Your mammogram, your bone density scans, maybe a low dose CT scan, your lung screening, a colonoscopy, even. Have you ever received a bill that you did not understand and just paid it? Or better yet, ignored it because you did not know what else to do? If any of those hit close to home, you are not alone. Reactive usage leads to higher cost, more stress, and worse outcomes. And the frustrating part is, it is not your fault that no one taught you a different way. But today, that changes. Now, let's talk about what proactive usage actually looks like, because this is where everything shifts. Proactive health insurance usage means that you understand your plan before you need it. It means that you know your deductible, your copays, your network, and your coverage. Not because something went wrong, but because you took the time to learn it first. Now, here's what that looks like in real practice. One, you understand your plan. Do you know what your deductible is right now without looking it up? Do you know the difference between what you pay in network versus out of network? This is foundational. You cannot use something well that you do not understand. Two, use your preventive care. Most health insurance plans cover preventive services at no cost to you. These services, your annual checkups, screenings, wellness visits, vaccines. But if you're not scheduling these, then you're leaving covered benefits on the table every single year. Every time you're supposed to have something, you should have something. We should be practicing prevention all the time. Um, Three, verify before you go. Before any procedure, specialist visit, or any major service at all, verify your coverage. One phone call or one visit to your member portal can save you hundreds or even thousands of dollars in unexpected bills. Four, I want you to know what is covered and what is not. I know that you don't like to read those little summaries that they give you at open enrollment, and that you don't even know that you should be requesting your plan manual. But I want you to know what's covered. Understand what's excluded, what's not excluded. It's extremely important that you know your benefits. Knowing in advance is going to protect you from surprises on the back end. And number five, I want you to ask questions early. Do not wait until you are in the middle of a healthcare situation to start asking questions. The earlier you ask, the more options that you have. Okay, so I want to share something with you that happened just this past Friday, because I feel that it is probably the perfect example of exactly what we've been talking about. A patient came in to verify whether a pre certification was on file for his upcoming CT scan. He had been calling his insurance company directly. I'm not going to name said company. And every time he called, they told him that nothing had been submitted and there was no authorization on file. So, of course, he was frustrated because today is Friday. He is scheduled to come in on Tuesday. And he was thinking, okay, so my doctor's office did not do what they needed to do. I don't have an authorization, and I'm going to end up being responsible for this. And honey, he was irritated, okay? All right. So, of course, he was confused, and I mean, he had every right to be, because he felt like we were dropping the ball. All right. But here is what was actually going on. This particular CT scan no longer requires a prior auth through his insurance company. And the reason his plan could not see the information he was looking for is because imaging services through his plan are currently being managed through a third party administrator, meaning a company outside of the plan. All right, stay with me. The plan itself for other services, it manages those authorizations. But for imaging, it does not. When he called, he spoke with someone in member services. In member services, they may or may not see the authorization, because that a lot of companies have, their own utilization management teams and prior authorization reps who know what they're. Let me back that up, because I don't want member services to think that I'm discounting their work. But there are also inbound teams for prior authorizations that know exactly where to look for that information. And if you are working with or you're insured with a really good payer, then your member services knows that information, and they usually reach out to ensure that the patient has the correct information. However, that may or may not have happened in his case. All right, so remember, we are back at the third party administrator. So when he called his insurance company, they genuinely just did not have access to all of the information related to their service. Now, I will be the first person to say that better systems should exist to make this clear for you as the patient. Heck, to make it clear for me as the provider. But they do not. They just do not. And because of that, there's a gap that exists. However, what I want you to focus on here is that this man did not wait until the day of his procedure to ask questions. He did not assume that the doctor's office did everything they were supposed to do and that everything was fine. And he was just going to show up expecting that it was all done and hoping for the best. He didn't do that. He came in ahead of time. He called his insurance plan. He asked the right questions and he gave himself the opportunity to get clarity before it became a problem. And I have to mention, he was a Medicare patient. And I was so proud of him because proactive usage, you all, it's not just for people who are young or who have a certain type of insurance. It really is for everyone at every age, and at every stage of life. So if you are a 26-year-old and let's say you may be getting insurance for the very first time on your own, ask questions. It is your right to do so. You should always have questions for the doctor, for the facility, for the insurance company. If they're working with a third party, those are things that you should know. Ask as many questions as you want. Now, this is what intentional healthcare looks like in real life. What he did, he wanted to make sure, and I'm guessing he probably had a bad experience in the past, but he wanted to ensure that everything was correct. This is what I want for you all. This is, I mean, I'm still excited that he did this, but I want you to walk away today with awareness and clarity. And I want you to be advocates for yourself. Remember, proactive usage leads to better care, lower cost, and better outcomes. And it starts with one decision, the decision to become more intentional. All right, let's talk about it. So, how do you actually make the shift from reactive to proactive usage? Um, the most important part of this that I want you to know is that it does not happen all at once, and it really doesn't have to. You're not going to just reset and jump from reactive to proactive tomorrow, right? Um, but I do want you to understand that making the shift is going to change your overall outcome, um, your health outcome, that is. I need you to stop using your health insurance reactively and to start using it proactively. And with using it proactively, I need you to be practicing prevention on purpose and being intentional in your health care. Okay. Now, here's a simple side by side. If you are seeing the screen that I want you to think about, when you are using reactive usage, you have high stress, higher out of pocket cost, delays in care, There's a lot of confusion and uncertainty. And yes, you are going to have worse health outcomes. However, when you are using your insurance proactively, you're going to experience less stress, lower out of pocket costs, timely access to care, clarity. You will have clarity and confidence. The difference is not your plan, the difference is not your income. The difference is your awareness and your intention and how you react and respond. Because, again, understanding your coverage today prevents problems tomorrow. And that's not just a tagline, you guys. That is a principle that will show up in your healthcare experience over and over again until you start applying it. Now, proactive usage, it definitely puts you in control of your health, your insurance plan, and your future. So, with your insurance plan, you're not in the middle of the doctor and the insurance company anymore because you are taking charge and becoming your own advocate. Okay, all right. So, I do want to share my journey with you because there is no way that I can be out here preaching that you all need to be proactive and practicing prevention without sharing my journey. Um, Although I work in healthcare and I have for the mass majority of my life, um, I too did not practice proactive health insurance usage. I also and it never even occurred to me. It never even occurred to me that I should do so. That's just how this system works because you don't think about it because I think we all see insurance as okay, we have to get insurance in case something goes wrong. But, as with life insurance and car insurance and everything else, we are learning that sometimes we have to use insurance before things go wrong, right? All right. So for me, I'll say that prior to COVID, I turned 40. Oh my gosh. Yeah, I'm getting up there. Um, right around COVID, I turned 40 and I had my first mammogram. And if you know anything about having a first mammogram, that was not a fun experience, okay? However, COVID came and I think I just kind of shut down and I wasn't really doing anything. I didn't go to the doctor like I was supposed to, I think for 2 years. So I didn't have a mammogram. And I would go see my primary care, that one appointment a year, and I was done. However, 2, 3 years after COVID, I got really sick. My iron was really low, and I was walking around short of breath, just, oh, I'm gonna get to the doctor, I'm gonna get there. And by the grace of God, I finally did um, go to the doctor. But that same day, I had to be admitted to the hospital to have a blood transfusion because my iron was so low that, I mean, I self-explanatory. There was nothing they could do outside of a blood transfusion because I neglected my own care and I walked around, for years not being proactive, right? Um, that ignited something in me. And then I started to find out other things. Now, for the most part, I don't have any hypertension, any diabetes. Like, I don't have any major health conditions outside of the iron. Um, However, since that time, because I had to spend the night in the hospital, I have made every effort to go to the doctor to get my screenings. I had my colonoscopy last year. Yes, I did not waste any time. I did wait a year because I was a little bit scared of what was going to happen, but I had it done and it wasn't that bad, y'all. It wasn't that bad. Um, but I've made a conscious decision to practice prevention because I do realize that I am getting older and I would like to make sure that I am not positioning myself to acquire any additional health concerns. Um, with that being said, currently I am working through trying to figure out my weight loss journey. If anyone else has been on this journey, you know it's not an easy one. I will just share the GLP-1s did not work for me. Um, but I did lose some weight on my own, and I am exploring other options, surgeries, things like that. I don't really know if I want the surgeries because, in a way, I kind of think that because I don't have any issues, that I may have surgery and it may cause me issues that I never really had. So I am weighing my options there, but I am at least exploring it. In addition to lifestyle modifications, diet and exercise, just so you know. However, I am very intentional now in my journey in my healthcare. I have a 93-year-old grandmother who is still driving, and I would like to be like that. Um, I remember when she was my age, she used to mow her grass. So I started mowing my grass a little bit. Not as much as she did, but just to create additional avenues to be active. And I'm telling you this because I want you to understand that it is a journey, that it's not going to change overnight, that you're not going to do everything perfectly initially, that it will take time, but you will have the tools to learn how to utilize your insurance properly. You can join my Insights Collective. It's a free community on the school platform. Um, you don't have to pay for anything you don't want to buy. I recommend that you join for free and you utilize every resource that I offer because you will understand your insurance just doing it. All right. Watch my videos. Guys, just being proactive in this process changes things in ways that you can't even foresee. I mean, even for me, even the small changes that I have made have had huge impacts on me. Now, if this video helped you, I'm going to move on because I'm long winded. But if this video helped you to see your health insurance differently, I want you to do 3 things right now. First, I want you to subscribe to this channel because we go deeper on these topics every week. Every week, you all, I will drop just a small this is what's coming video with my avatar, and then there will be a video with me, just kind of following up to give some additional details. Second, I want you to drop a comment below and tell me, are you currently using your insurance reactively or proactively? Or are you somewhere in the middle of that process? Sometimes you're using it like you probably should, and sometimes you're not. Just be honest. This is a judgment-free space. And third, I want you to visit my Insights Collective, my free learning community, where we continue these conversations and we go even deeper together. You do not have to figure this out alone, and you do not have to learn everything overnight. Start where you are, learn one step at a time. Be intentional, practice prevention on purpose. Remember that it is your health, your insurance, your power. I will see you in the next video as we continue to make health insurance make sense. Bye for now.